Hello, this is Dr. Indrani Lodh from Urvaraa IVF, the fertility clinic. All of you are aware of our tagline. Our tagline says, we turn couples into families. It is our utmost endeavor to treat the couple and help them to walk out of the clinic with a baby in their arms. But then sometimes, the story is not so easy and simple. The lady takes tablets and injections and treatments in order to get pregnant. The egg is fertilized. I don't know if you know, the female egg gets fertilized in one of the fallopian tubes in our body. But many a times what happens is, after fertilization, the embryo rolls down through the fallopian tube and comes to the cavity of the uterus, or for those who do not understand uterus, the cavity of the womb, where the baby grows into a full term normal human being in the form of a baby. But due to some internal strictures inside the fallopian tube, or due to some obstruction from outside on the fallopian tube, many a times what happens is the zygote gets stuck in the pipe of the fallopian tube, or in the lumen of the fallopian tube, as we describe in medical terms. This condition is known as ectopic pregnancy. Ectopic means outside. A thing, it should be inside the uterus, but instead of being inside the uterine cavity, it is outside the uterine cavity, inside the fallopian tube. Inside the fallopian tube is the commonest site of ectopic pregnancies, but many a times it can also be on the surface of the ovary, in one of the corners of the uterus, or sometimes even outside the uterus, maybe on the intestine or the omentum, something like that. Those are very rare conditions. The incidence of ectopic pregnancy is 1 in 1 lakh. But still I'm talking about it today. Why am I talking about it? I'm talking about it because when the pregnancy begins to grow inside the fallopian tube, as the pregnancy grows, the fallopian tube may burst. And when the fallopian tube bursts, it gives rise to a lot of bleeding. And this bleeding takes place inside the abdomen or inside the tummy. And many a times, this bleeding can also prove fatal. Our Bollywood film star Kajol had suffered ectopic pregnancy, and that was the time when ectopic pregnancy was something which really became known to a lot of people. Though it is rare, because the condition is very, very serious and it can even prove fatal, that is why, we need to be aware of this condition called ectopic pregnancy. How does a doctor diagnose ectopic pregnancy? Firstly, when we were doing our medical syllabus, we were told that in order to diagnose an ectopic pregnancy, you need to be ectopic minded, which means that what mind does not know, the eyes do not see. So you should have the doubt of ectopic pregnancy in your mind. How do you diagnose? A very early transvaginal sonography scan, if performed, can diagnose ectopic pregnancy. In other words, we do it in this way. Suppose a lady comes to us with pregnancy, or say she has missed her period. So what we do is, we do a blood test to confirm the pregnancy. The name of the blood test is serum beta HCG. And we also do a transvaginal scan. Now, if the blood test is positive and if we see a gestational sac inside the uterine cavity, then everything is fine. But if the blood test is positive and we are not able to see the sac or the baby inside the uterine cavity, that is the time we should have the suspicion that, isn't it so that the baby is developing something somewhere outside the uterine cavity, and that commonest site is the fallopian tube. So with the help of the ultrasonography scan, you can actually focus a small tiny sac in one of the fallopian tubes. Is found on the side of the uterus, and the cavity of the uterus is empty. That in itself is clinches the diagnosis. Once you have diagnosed tubal ectopic, you should treat it as a real serious emergency, and the more you can catch it before it ruptures, the more creditable it is. If the sac is very small, many a times we treat it medically, or in other words, you do not need to do an operation for it. What do? There are some medicines like methotrexate. If they are given, then it can kill the pregnancy tissue inside the fallopian tube, and then it just shrinks, and the hormone called beta HCG titer keeps falling till it comes down to 0. So that is the medical management, but medical management can be done only if there is an unruptured tubal ectopic pregnancy. If the tube has ruptured, then it is really very serious. You need to get admitted to a hospital, and then nowadays we don't need to cut open the tummy. You can tackle this condition with the help of a laparoscope. And so, we put in a telescope through the belly button of the lady, and also make some accessory 2 or 3 holes on each side of the belly button, and with the help of that, first we suck out the blood from the cavity, and later on we identify where is the seat of rupture, and there you will find that there are bleeding spots, and we just need to stop the bleeding, give a thorough wash to the pelvis, and that's about it. The operation is done. The operation is technically a bit skillful, but it does not take much time, and the lady has a very fast recovery. In fact, she can be discharged within 24 hours of the operation. In my YouTube channel Indrani Lodh, you will find that I have uploaded some videos of ectopic pregnancy and how we tackle them laparoscopically. So my message to you patients is that you just need to be aware of a condition called ectopic pregnancy, and you need to report to the doctor as early as maybe 2 to 3 days once you've missed your periods. Go through your blood test, serum beta HCG level, go through a transvaginal sonography, and be sure that it's not an ectopic pregnancy and it's a pregnancy inside the uterus, and then everything is going to be all right. If it is ectopic, then the earlier you diagnose, the better, and once you diagnose, you should treat it laparoscopically through an operation or with the help of a medicine called methotrexate. That decision will be taken by us if it happens at all. So there's nothing to worry. For any of your problems, any gynecological issue, please come to Urvaraa IVF, which happens to be a one-stop solution for all fertility and gynecological issues of women. Contact us at 033 2475 6000, Monday to Saturday, 10 a.m. to 6 p.m. for an appointment.